therapies. And it's always good, I think, to have a pulmonologist on board if you're discussing, for example, surgery or radiation therapy, because underlying lung function is going to have a great impact upon whether or not a patient's going to be a candidate for an intervention. A patient may be a perfect candidate for surgery, but may not be someone who could survive the surgery from a lung function perspective. So I think our general pulmonary skills do come in handy, even though we're very interested in the scientific side.
So, Tobias, I wonder if you could just the basics. After an extrapleural lumenectomy, how does a patient breathe? Could you sort of explain, how the other lung will take over, and sort of some of the changes of, what are patients to expect following that type of a surgery?
Yeah, the extrapleural lumenectomy is obviously a very invasive surgery, as you've heard in some of the previous presentations. During an extrapleural lumenectomy, the lung as well as the pleural surfaces are pretty much excised in an en bloc procedure, so they all come out as one piece, so to speak. And what that pretty much does is, not only does it mean a lot of trauma to the patient, so it's a big surgery that causes quite a bit of tissue injury and results then in has to require a lot of healing afterwards. You also pretty much lose 50% of your lung function in this context. And it's also important to know that as we all go through life, we acquire lung diseases that affect our lungs. And so if I say 50% of your lung function, you're basically left with the other half of your lung, and that may be affected by a different disease. For instance, some patients smoked during their use, and they may have COPD or emphysema, which may affect the other lung. So it may not be exactly 50% of the ideal